Okay, that's my one card. Okay, and this is where we're going to be filming. That's my wife, Yakima. This is JONATHANSHAMATUTU. Jonathan Tremaine. Okay. So I'm going to ask the patient questions. So have you had any shortness of breath?
I don't think so.
Have you had any palpitations?
Heart palpitation? No.
Okay. What about any chest pain?
Chest pains? I have an ache in my upper chest.
Okay. Any irregular history of irregular heartbeat or anything like that that's happening?
No, but I think it might be faster now.
Cardiac or GI history?
I take a pill because my cholesterol is high and so is my blood pressure.
Abdominal pain?
I have a stomach pain right in the middle of my stomach right here.
Any what about appetite?
It is good.
Any nausea or vomiting?
Nausea and vomit. I am nauseous and I did vomit once.
Bowel habits?
Normal.
Okay, so then vital signs 105 is not normal. Blood pressure is 167/100, not normal. Temperature is 37, so there's no fever. And the last one is 20. The patient is experiencing, the tachypnic in this case. And next thing I'm going to do is inspect the heart. So for any pulsations, no obvious signs of pulsations, you trace the right carotid artery, so the jugular venous distension, no, that's not there either. That would be a sign of somebody experiencing heart failure. Next thing I'm going to do is listen to the heart. Using the diaphragm. That's the aortic, pulmonic, Erb's point, tricuspid valve, and mitral. So the mitral is where I'll be listening to the apical impulse. It's where you can hear the heart the most. And this is good for somebody experiencing irregular heartbeat. Okay. I'm going to use the bell end of the stethoscope. Same locations, aortic, okay, and with the bell end, I'm listening for any murmurs. So murmurs will be like a whooshing sound. Okay, so next up I'm going to do is the artery, and the pulse, carotid, radial, brachial, and I can feel pulse on both ends. And then I'm going to do the dorsalis pedis right after. So next up I'm going to do is an abdominal assessment. Just need you to move your shirt. There we go. Okay, so dorsalis pedis is right here, and I can feel dorsalis pedis on both. And next up is the abdomen. It's symmetrical. It's slightly on the round side. There is striae, which is normal. There is no rash, and there's no bruising or anything like that. Next up is going to be listening to abdomen. Starting off with the right lower quadrant, which is where the appendix is. Right upper quadrant. Bowel sounds are present. No hyperactive or no hypoactive sounds either. Left upper quadrant and left lower quadrant, which is where the descending colon is. Okay, so the right upper quadrant would have the liver, and the left upper quadrant would have the stomach. Okay, so next up is palpation, so percussion rather. If there's a dow sound, it means there's either a lump or there's an organ. So I can feel probably organs in that case. And tympanic sounds are usually gas sounds. Okay, next up I'm going to do is palpation. Just feeling for any masses or any lumps. And I'm going clockwise through all four quadrants, starting off with the left lower quadrant, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. All right, so there we go. So nothing that's too insignificant there. And you can sit. I'm going to call the doctor now. So, hi, Dr. Brown, Mr. Jonathan. I'm calling about a 63-year-old female patient who has complained about chest pain, which is slightly on the mild side, severe abdominal pain. She's also had shoulder pain, and she's also complained about nausea and vomiting. She has a history of hypertension as well as diabetes. She also has a history of that in the family with her dad. She's been anxious and distressed. She's been cool and climbing to the touch as well. So these are symptoms that are part of MI, especially with the shoulder pain and stuff. So I was just wondering, doctor, if you can order an ECG so we can see what's going on, as well as enzymes, and could you also order doctor, if there's any other recommendations that you have, just let me know. But what I've put her on is I've given a nitro, which is also part of your order. But if you could also order morphine, just in case she's got anything that's that's severe as far as her pain's concerned. And if you can come assess her real quick, that'd be great, doctor. Okay, so as far as the patient's concerned, the patient's got MI, most likely because of how they're presenting. The patient would have an ECG order for them, stat. I would also have enzymes order for them. I would administer medications like nitroglycerin, and if it's anything worse, would administer morphine as well. The patient would be put in semi-founders position to help them with their breathing as well, and the patient will be spoken to as and for them to be remain calm, as calm as possible. But these are classic symptoms of an MI. All right, thank you.